Jackie from Manchester, UK. Is it possible to regain movement in the upper lip 13 years after Bell's palsy onset? Yes. Let me show you something. As you can see here on these moving arrows, the movement of the upper lip is regulated by basically three muscles. This is the circular muscle of the mouth. This is the contraction vector of the muscle. So when you pucker the lips, the mouth corner goes this way towards the central line. And there are two other muscles. This one, it's nasalis and levator labii superioris. It's a Latin names. These are the Latin names, but it means that this is the muscle that wrinkles the nose and lifts the upper lip. I have to say that from my experience, of course, that usually it's not only the upper lip or this or that part of the facial muscles are not moving. Usually it's a complex situation, and that's why we don't have all the answers on the remote basis, because we need to see the patient live. And although with a picture that we will ask you to send to us, we can see quite a lot in the picture of your recovery. We need to make the measurements. We have an equipment so we can measure the recovery level of the facial nerve, all the branches. There are 5: zygomatic branch, temporal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. There are 5 of them, and each of them is innervating certain facial muscles. And of course, they can recover to a different from each other recovery degree. So we have to see, and in principle, it is, yes, possible to improve the situation, not only because it depends on the recovery of the facial nerve as such, but also because it depends on the habits that our brain has developed or lost, for that matter, during those 13 years after facial palsy onset, Jackie. Anonymous attendee asks, how to achieve speaking with both sides equally? The non-affected side is much stronger and the muscles draw towards it while speaking. If the recovery level is low, then indeed the healthy side may pull over the affected side. Well, in this case, you need to train your brain to balance the efforts level. If your affected side is showing movements, even if they are not symmetrical with the other side, which means that your facial nerve has recovered at least to a certain degree, and your brain is sending stronger signals to the healthy side than it's sending to the affected side. Or otherwise, you may have an impression that your affected side is not strong enough, and at the same time, it's not the case, but the resistance of antagonistic muscles is taking place, and they just prevent you from having your regular movements, having natural patterns, because they are, every time you want to smile, for example, the muscle depressor anguli oris, the pulling the mouth corner depressor, is trying to pull over. Birgitta asks, I can't keep the water in my mouth, for example, when rinsing my mouth. How can I train to keep it closed? Well, if Birgitta is the Birgitta I know, we both know that you have experienced facial palsy 3 times, Bell's palsy on the same side. Your facial nerve branch is still recovering, and there could be 2 causes for the fact that you cannot keep water in your mouth. Is that one of the 2, either your muscles around the mouth area on the affected side, the circular muscle of the mouth, upper lip, lower lip, are not yet to have sufficient power, or sometimes it's because the depressor anguli oris muscle, the muscle that pulls down the mouth corner, when you are moving the water in your mouth or trying to blow your cheeks, it involuntarily contracts and pulls down your mouth corner, thus making your water leak. I'm not going to rinse my mouth now, but I will show you how the contraction of the muscle can lead to leaking air from the when we blow the cheeks. Have a look. So when my mouth corner is pulled down, either by my finger or by involuntary contraction of the mouth, of the muscle that pulls down the mouth corner, the water and air may leak. Igor is asking, hello, what about the weakness of facial muscles? Is it happens due to improper behavior and can be restored, or the nerve is so damaged that it can't produce enough power? Thank you, Igor, for your question. The weakness of facial muscles, as I explained already, can be, if it is real, if it is a real weakness, the muscles are weak, then most of the time it is that the facial nerve has not recovered yet sufficiently to produce a proper level of contraction of the facial muscle. For example, as you know, probably, the facial nerve is not a single wire, but it's a bunch of wires like a telephone cable. And it has branches, and each branch is innervating certain muscles, and each branch is subdividing into sub-branches until single muscle, until single nerve fiber is innervating one or two or up to 5 muscle fibers. And if, for example, most of the time most of the complaints is to the zygomatic muscles, which are producing the smile. If, for example, on the healthy side, there are 300 nerve fibers connected to the muscle, on the affected side, it could be 100 or 150 or 75. Then you will experience certain weakness of the facial muscles. That is what is causing. And to do that, to improve, we need to be patient first, because if you are on the very early stages of your recovery, then you may have to wait for improvements. Michelle is asking, how many years does the nerve continue to heal? Again, to heal is not really the correct term, I would say. To regenerate, well, it's difficult to say. We have seen patients who have, especially after the congenital facial palsy, who within 15, 20 or 30 years have achieved quite a considerable regeneration level of the nerve. I would say that active regeneration of the nerve, very active, continues within 6 to 7 months. The most active is, of course, it is within the first 3-4 months. Then it goes slower, and after year after year, it reaches more or less a plateau, after which time mark, only incremental improvements in the regeneration of the nerve can be expected. That's my judgment. However, very small improvements in the regeneration of the nerve may happen, and even within longer period than 1 or 2 years, and especially when you apply proper stimulation, as I described earlier during this presentation, we may experience, and we have experienced, improvement of the regeneration levels of the facial nerve, at least in certain branches.